As you get older, sometimes you have trouble finding words. So my daughter got all worried, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, "It looks like you had a couple small strokes. They're small, they're not going to bother you. But," he says, "you need to go to a cardiologist to check out your heart, just to be on the safe side."
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. And she says, "Could you see the mitral valve there?" I said, "No, I'm not trained for that." She points with it to her pen and says, "Right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything." And so she says, "Within a month, you're going to have a massive heart failure." And I heard my wife gasp, and I got rocked. I said, "Wait a minute, I feel fine." She said, "I'm checking you into the hospital right now."
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Varughese hadn't caught that ruined mitral valve, and so I owe her.